On this session that we had on the Satellite Symposium, Dr. Steven Schuster and Dr. Gregor Nowakowski from Mayo participated, as well as myself, and discussing the new antibody-based therapies that are available for diffuse large B-cell lymphoma, which have been continued to increase in availability. We started with tafasitamab, but we've also added CAR T cells, and we've also added now bispecifics, which are expected to become available soon for patients. One of them is already available in the follicular lymphoma world in Europe. All these therapies have significant activity, and some of them have different mechanisms of action. Most of them are based on the antibody colocalizing with a cell, or colocalizing an immune cell close to the cancer cell, or bringing chemotherapy to the liver as potent cytotoxic at lower doses in a targeted fashion. What is relevant is that many of these products target the same antigen, and what we're trying to figure out is whether you can sequence drugs that target the same antigen and preserve some degree of activity, particularly because some of these treatments are considered to be potentially curative, like CAR T cells, and whether we can treat with other agents before CAR T cells without affecting their activity. In general, we explored in this session whether that can be done, whether sequential treatments targeting CD19 or using immune targeting of the lymphoma can result in activity. And we explored early evidence from case reports, as well as some clinical trials that have subgroups where patients have been previously treated with CAR T cells or have subsequently been treated with CAR T cells, showing that an approach where you do sequential immunotherapies for patients is feasible without affecting the efficacy of each one of these therapies. And this will set up a bigger discussion on further trials to determine whether you can have a sequence of immunotherapies that can be more effective and achieve better responses to disease control in our diffuse large B-cell lymphoma patients and other lymphoma subtypes as well.